what was that study, and then what did you find kind of valuable with that?
Yeah, I think it was, this comes from Andreo Spina. I'm pretty sure he's a Dutch guy, if I remember correctly. But he has a whole, compilation on lumbar or pelvis complex and all issues surrounding that area. But it just happened to be a statistic that point, that just is easy to remember. I think it was like 71% of low back pain has a recurrence within 1 year. So 71% of acute cases that came in had a recurrence within 1 year, which is quite high, which tells us that even though these people sought treatment, it was temporary. It was not a fix. It was just enough to numb it, to desensitize the person temporarily. Yeah. And they used, I don't know if it was directly tied, but I was reading another study about they were trying to decrease that percentage within 1 year of recurrence, and they were attacking gait, for example, trying to treat gait in a way of trying to figure out a solution to why it's there in the first place. So they would notice certain things, like the person couldn't extend their hip. And then they would also notice that, well, they couldn't extend their hip because they had no, toe extension. So they had like hallux limitus. So then they would, just shod these people in shoes that would be more comfortable for that, so they could extend their toe or at least push off and extend their hip, and it would like decreased the recurrence, the likelihood of a recurrence within 1 year by 80%, just by attacking gait. So if you just have some strategy, you just have to have some strategy in place for attacking why the thing is there, right? Not just temporary relief of symptoms, which, for us, it can be just mobilizing that area all the time. And, and for physios, it can be always doing some form of interferential E-stim and then ultrasound. And some of these, they're all fine. Those things are all good modalities used in conjunction with some other greater schematic or vision that you have for that patient.
No, I think that's, if we could just get one message across this podcast, I think it'd just be like, okay, there is a problem in the low back or wherever there is. And perhaps there's also something that is also kind of causing that problem, and to think about that a little bit. Other than that, great show, man. I appreciate all the insight. Tune in next time to the Anatomy of Therapy. Peace.